knows how much storage I have in that phone. Okay. All right, guys. So I'm gonna try to make this not, it's informative, right? So I'm gonna go over stuff that you may or may not have heard of before. Hopefully you're gonna learn something new. And then at the end, if you guys have any questions, let me know. Okay, I'm gonna try and kind of go through this generally quickly, so that we're not here super late, right? The time change is killing us. So we're gonna talk about what the pelvic floor is, right? And just the pelvic girdle in general, the role of the pelvic floor and pelvic girdle, common conditions in pregnancy and postpartum, talking about exercise postpartum, and then how PT can help and what it looks like if you're doing a postpartum evaluation. Okay. So going over the pelvic girdle anatomy, and that's just going to be the bones. So you have your SI joint, right, which is going to be your sacroiliac joint, and that's your sacrum, which is the bone here, and your iliac. So you have your SI joint, you have your pubic symphysis. So if you have been pregnant, this is a really common area where you can have some pain. Maybe you guys have experienced that before. And the pelvic cavity, which is where all the organs sit in. And the pelvic ring is going to be around that area where the pubic symphysis is, where your pubic bone is, down in the middle. So functions of the pelvic girdle, it's going to transmit load from legs during walking. So a lot of times if you have pain in this, like single leg type stuff can bother you. Support the weight of your body in sitting. It provides attachments for muscles, ligaments, your spine, your abdominal wall, and then it also protects your organs, vessels, nerves, that kind of stuff, right? So then we have looking at the vulva from the down up view, right? So this is something that we commonly call the vagina, but it's actually your vulva. So your vagina is a cavity, and that's inside of your body. So from the anatomy down, right, we need to be able to understand and look at this type of stuff when we're talking about pelvic floor. So your mons pubis is just the area where like the top of your pubic bone is. The hood of the clitoris up at the top, then kind of going down, clitoris, labia, minora, majora, so large and small. The perineal body, which is going to be that area between your vulva and your anus, right? So if you've had children before, potentially you had some perineal tearing, or maybe had an episiotomy, that could be something. We'll talk about that. So talking about the pelvic floor anatomy, it's kind of layered. So again, so we saw the skin model. These are actually flipped, no, same direction, right? So same direction. So we saw this skin model, and now we're looking more at the layer of muscles. So the top is going to be the most superficial layer, and basically we're just looking at the muscles that are surrounding the urethra and the genitals, as well as the anus. So layers 1 and 2, these are actually layer 1 and layer 2. But their main functions are closing the urethra, the vagina, and the anus, and then also maintaining clitoral erection. So this is a completely side note. I should have actually put a bigger picture of a clitoris. But if you guys have never looked at like an anatomy picture of a clitoris, it actually looks very similar to a penis. So it's basically like a mini penis.
No.
So,
it does.
Yeah, and so, but I mean, obviously it's a large part of sexual function, right? So maintaining that, those muscles, when we talk about the function of the pelvic floor, sexual function is a part of it, but also being able to orgasm and the intensity of your orgasm is also related to your pelvic floor muscle function and strength. So it's not just about peeing your pants or other things, right? So then you have the third layer, and this is actually looking, so the first one was looking like if you had your legs spread and you were looking this way. The second one is now looking down, like through into your pelvic bowl. So this would be your anus in the back and then moving forward. I'm sorry, opposite way. The anus in the back and then moving forward. So your pubic symphysis is in the front, which is where that pelvic ring is. right? So now this is all the muscles that are supporting your pelvis, they're supporting your organs are sitting on top of this, and then they're helping stabilize the trunk with the lower body. So we'll talk about the way that the pelvic floor, these muscles specifically, kind of act similarly and in synergy with the diaphragm. So you have, this is referred to as your pelvic diaphragm, right? It contracts and lifts just like your diaphragm contracts and lifts as you're breathing. And they are the respiratory diaphragm and your pelvic diaphragm are the ceiling and the floor to your core. Okay, so they're directly connected to your core. And then the functions of the pelvic floor. So obviously supporting your pelvic organs, controlling your bowel and bladder. We talked about those, the ability for those muscles to squeeze and relax. Sexual function, stabilization, and then they also have a role in circulation and lymphatic. And the way your pelvic floor works is like a hammock, right? So you have this anatomical model here. So your pubic bone down to your tailbone, and then if you look at this here, this would be kind of tilted, but your pubic bone to your tailbone, and your pelvic floor muscle sits as a hammock, and all of your organs and things sit on top of that, right? So it always has some resting tone. So you have the ability to, the way that they kind of talk about it is like, think about an elevator. So your first floor is your resting tone of your pelvic floor. You can lift it, so you should be able to go to the second floor, and then you should be able to relax it. You should be able to go to the basement. So you're always having resting tone, which is level 1 of your pelvic floor. If not, we would obviously have like full loss of bowel and bladder and that kind of stuff, right? So thinking about your pelvic floor, you should be able to just be normal. You should be able to lift it, and then you should also be able to bear down or lengthen. So pregnancy and effects birth on the pelvic floor muscles. Obviously, as the weight of your uterus and child increases, it's going to put more stress. Your pelvic floor is having to take more stress in supporting. It also increases overall abdominal pressure when you are pregnant. And then cesarean sections definitely have some protective benefits over some pelvic floor muscle function. And again, we're just talking about pelvic floor muscle function, but not obviously necessarily the core stuff, but it's not entirely, so there's still some correlation to some of these things. So we're gonna go over some of the common things within pelvic floor and things that PTs can help with early on and later on. So perennial injuries, most vaginal births have some form of perennial injury. And then here's your grading system of 1 to 4, based upon how much is involved in the tear. So just the skin and the muscles, but not the anal sphincter. The anal sphincter is involved, and then the anal rectal mucosa, which is a little bit deeper, is involved, and that's just a grading scale. Then urinary incontinence, and we'll go over the types, but that's just basically your changes in the ability to hold in urine. So 1 in 3 women, about 33%, will experience that urinary incontinence at 3 months. And then after 4 years postpartum, it's still reported in almost still about 1 in 3, so 29%. Have some symptoms within the 4 years, and the chances increase if you were experiencing symptoms within the first year. And then obviously vaginal birth is 2 times more likely for urinary incontinence, stress or urge incontinence, and then there wasn't any difference regarding instrument or non-instrument. And then, so types of urinary incontinence, these are more, there's actually a bunch, but these are more specific to pregnancy and postpartum. So stress urinary incontinence, which is leaking with coughing, sneezing, jumping, running, laughing. Really what this means is you'll notice it's a lot of changes in pressure of the abdominal system. Urge incontinence, so the sudden urge to go, like where you can't hold it. So you think about going, and then like as you're running to the bathroom, you have a little dribble. And then mixed, which is basically both of these can happen together as well. So some of these questions, and I'm gonna send you guys this so you can like reflect a little bit more on your own. But basically, these are questions to ask yourself. So after each kind of thing, I have a questionnaire thing that you would ask yourself if this is potentially happening. You would want to seek some additional assistance through pelvic floor therapy. But any concerns with bowel and bladder, leaking with coughing, sneezing, laughing activity, strong urge, pain with emptying the bladder, needing to strain or push, or feeling like you aren't completely emptying. And then specific, that's just general bladder health, and then specific to stress or urge incontinence. In the past 3 months, have you leaked urine? Even a small amount is not considered normal. Do you leak with specific activity? And then which is most often? And then fecal incontinence is also associated with pregnancy postpartum. And then basically the difference between fecal and anal is that fecal incontinence is specifically more liquid or stool, whereas anal incontinence also includes gas. And then the statistics for fecal incontinence, anal incontinence, and just general fecal urgency. I'm like, what was the U? Increased urgency, right? And then higher incidence with a higher degree in perennial tears, obviously, because you're losing some of that support. And then some questions regarding fecal incontinence, bowel health, do you have to push or strain? Do you feel like you're completely emptying? Is having a bowel movement painful? And do you have any bowel leakage? These could also be questions that you might ask if you're potentially experiencing constipation. So constipation is actually going to be really related to the next thing we're going to talk about. But if you had constipation like as something prior to even pregnancy, so maybe that you're not having regular bowel movements or it's challenging to have regular bowel movements, then this can increase even more when you're pregnant if that's something that you've personally experienced. Obviously due to hormone changes as well as some trauma related to pregnancy. And chronic constipation, if you've ever been constipated before and you've had to bear down and you do that repetitively over and over and over, can definitely cause some stress onto your pelvic floor. And it's highly correlated with the next thing, which is pelvic organ prolapse. So when you're looking at prolapse, it's basically the invagination of your pelvic organs. It's really difficult to say those 3 words together. So this is a normal anatomy, right? So you have your bladder, your uterus, and your rectum. And if you want to look at my pelvic model, you can kind of see they're very closely related. And you notice that the uterus, right, you have your vagina, and then, which is that, your actual canal, and then you have the uterus here that's sitting up high, right? So with a cystocele, your bladder is actually pressing down and pushing down and descended towards the vagina. You can have a uterine prolapse, which is, if you notice the top here, the uterus is a little bit higher, that's starting to come down into the vaginal opening. And then you can have erectocele, which is the anus is invaginating into the vaginal opening here, okay? So 3 different forms, and then there's also grading as well. Generally, most times they say that oftentimes after pregnancy, a grade 1 or 2 prolapse is very common. So obviously you've had a baby come out of your vagina, talking more specifically vaginal, and they could be asymptomatic, you may not even know that it's going on. But when you're talking about a grade 3 or 4, usually that's when you might be apparent that there's something going on. So you might actually feel or see a bulge coming out of your vagina. You might have pressure or discomfort. There might be an altered stream of urine, slow leak. You might have to do like a double pee, or you might have some leaking afterwards. You may have the need for splinting. It's something that without even, we kind of figure things out on our own sometimes, and you might have had to do this on your own. You may not even know, but just pushing up helps. So that's technically splinting, and then you might have experiencing discomfort with sex. So questions for POP, pelvic organ prolapse, if you're feeling pressure in your vagina or perineum. Do you see a bulge? Oftentimes, I mean, I've had people that I know that have experienced this, and they'll go to their doctor and think like, I have cancer or something going on, and it's really pelvic organ prolapse. So outside of pregnancy, although most of you are too young to obviously have had a hysterectomy, I'm guessing none of you have had that.
No.
But oftentimes hysterectomy can increase prolapse because of the way that your organs kind of sit with each other. That you can actually get prolapse because there's less support in general within the pelvic bowl. And that's also something we'll talk about later here in just a couple slides regarding support, that you actually, when it comes to like orthopedic injuries, so those are more pelvic floor specific, but also there's orthopedic injuries and pain that are correlated with pregnancy as well. So dyspareunia is painful sex, it's a medical term for painful sex. And this can happen after having babies due to hormone changes. Your changes in estrogen can, again, which is also correlated with breastfeeding, can lower your ability for lubrication. Obviously tears or episiotomies, C-sections, not just, and some of this is also like functional, right? Just thinking about positions, obviously emotional distress, exhaustion, and then hypertonicity of pelvic floor muscles. So hypertonicity is basically increased tone and tightness. And just a statistic that 3 months postpartum, 40 to 50% of women had experienced painful sex. And if this is something that you've ever experienced, and it may not necessarily even be, again, this could be something that you've experienced prior to having childbirth. It also, which could still be pelvic floor related, and also things like putting in a tampon or taking out a tampon, or things that feel uncomfortable, having a speculum put in, like more than, obviously that's just uncomfortable for everybody, but more than like normal to where you feel like you physically can't. Those are all things that could also be related to pelvic floor. And if anyone ever tells you like, just have a drink or like relax, like those are not sufficient responses for this type of thing. So questions regarding your sexual health, do you have any concerns? Does pain limit any sexual activities? Are you able to have an orgasm? And do you have pain or discomfort in your vagina or perineal area? Okay, so those are majority of the pelvic floor specific things. All right, so moving on to diastasis recti. So obviously not necessarily pelvic floor related, but absolutely related to physical therapy as well as pregnancy. So as you become pregnant and your stomach stretches, you also get stretching of the abdominal wall, specifically of the linea alba, which is the line that connects your rectus abdominis muscles, right? So this is a normal thing that happens as your baby grows. You have nowhere to go but forward. So a couple of pictures of diastasis. You might hear it pronounced diastasis. It's pronounced lots of ways, DRA. So different types of diastasis and what that looks like in different areas. And basically it's just the stretching of that connective tissue down the middle, right? Your abs are not ripped apart, like your organs are still safe, things are still good in there, but it is stretched, right? So you obviously you can't see this person's organs because they're still protected. So up to 32% of women will experience symptoms of DRA in 1 year. And what we want to do is measuring this. So more than a 2-finger width separation is considered having diastasis recti, and they use a grading system dependent upon 2, 3, and 4 finger widths. And essentially you want it to feel, when you're pushing down, you want it to feel like a rebound, right? Like a trampoline. It shouldn't feel like it's sinking in. But the good thing is, generally speaking, mild to moderate DRA can be treated with physical therapy, right? So you're gonna be strengthening So depending upon the type of DRA that you have, obviously there's a couple of different things like we saw here, will depend upon what types of muscles we're going to work in order to help close and heal. And then not on here, but because it's obviously, we're talking about conservative management, but there are also options for surgery if that's something that is excessive down the road. And additionally, as you know, there's, even if you heal a diastasis, you could potentially still have loose skin in the area, but the great thing is like exercising and getting more muscle definition helps generally build that skin. Obviously over time, it's your body changes, it's just what happens, right? So number one is knowing that what society shows you as normal and what's like actually normal aren't always in line. So having, understanding what this looks like and then deciding what's gonna be the best thing for you moving forward at the end of the day.
Is that the surgery with the net?
So the mesh, I know that they have a mesh for the POP, but they also could have it, I'm assuming that net comes in between.
Yeah.
So usually it's an abdominoplasty, so I don't know the exact surgery, but it would be considered similar to like an abdominoplasty where they're doing like a tummy tuck, essentially. Depending upon the severity, there might be some sort of like net or meshing involved to help close. And then just a couple more here, guys. So going into more orthopedic things related. So obviously back pain, SI joint pain, and pelvic pain are all closely related as you're pregnant. So obviously once your stomach gets stretched and things just aren't being used the same, we have weakness that's present there, just absolutely normal with what you guys go through. If you've never had anyone look at lifting mechanics, that's always very helpful. Positional changes, so when you're pregnant, Jenna can probably be a great model for us, but you're gonna have lots of changes in the way that your body is and where the tension is being held, right? So obviously your weight is a lot more forward, you have a more hinge point lower into like upper, mid, back, you have a lot more extension in your low back, a lot more tightness in your back. So all these things are just normal because you've been in this position for prolonged periods of time. And then Jenna, this actually made me think of you because you mentioned that generally speaking you feel pretty good during your pregnancy, but afterwards you've had some back pain before. And actually having no baby in there, because having a baby does provide some stability with everything, and then having nothing from going from having something to nothing can also be an effect of changes in stability, and it's just how your body responds. Everyone's body is different, right? So exercise postpartum. So this is a really big one that I'm trying to hopefully get in with some like OBs, and if y'all have any connections, I would love to talk to you about them. But basically, we hear no exercise for 6 weeks, and obviously this is gonna be to each individual, but we're talking about someone who's generally healthy, has no complications, this type of thing. There is stuff that you can do early postpartum. It's not gonna look like, hard exercise, but, breathing mechanics, early bracing mechanics, pelvic floor contraction type stuff, connecting with your pelvic floor, understanding how things feel again, using your glutes, obviously like walking and doing basic things like that, and even just learning how to hold a baby while you're doing things, because they tell you like you can't lift, you can't do this, but it's like you have to do things as a mom, right? It's like it's either do things or not do things, so you gotta figure it out. But just basic functional patterns and how to progress to exercise after the baby too, because that's something that, as you guys can see here, I'm definitely more exercise based in terms of like the population that I work with. So this is the kind of stuff that I really enjoy when it comes to the exercise stuff. So after covering all that stuff, a couple of ways that PT can help, right? So based upon each individual category, and I won't go over everything specifically. Obviously, it's gonna be like strengthen the things that are weak, lengthen the things that are tight. If there's some coordination issues, we need to focus on that. You know, habit changes, dietary changes when it comes to bowel and bladder type stuff. Scar management when it comes to things like pain related activities or maybe even early on, directly postpartum. Again, like I said, I'll send you guys these things so you can see a little bit more, but diastasis is a lot of looking at rib positions, breathing mechanics, coordination between your pelvic floor and your core, obviously all of your general orthopedic injury type stuff. When you look at just the pelvic floor in general, if you imagine your pelvic floor and your hip, everything is very closely related. So think about your tailbone, where your pelvic floor muscles connect from the inside, your hamstring connects on the outside, and all of your hip musculature is connecting there. So they're very interrelated when we're talking about hip, SI joint pain, and back pain. So pelvic floor can also tie in as well.
Is SI what?
So sacroiliac joint.
Oh.
Yeah. And then looking at what does a postpartum eval look like. So obviously general in-depth history of anything that we need to focus on. There is a two-part exam, external and internal. So not everyone is going to require an internal exam. If you have some sort of an incontinence issue or painful sex, those are definitely things that you would want to have an internal exam. But external exam is going to look very similar to your general orthopedic, but looking at things like breathing, pelvic position, rib position, just your general testing, muscle testing, and that kind of stuff. And then your internal exam, it's a lot different than what you're getting done at your OB. Well, in terms of like you're not using a speculum or any of those types of things. It's a gloved finger. You're looking at pelvic muscle contraction, so you're assessing pelvic muscle ability to contract, endurance. You're also assessing internal potential trigger points or tight muscles. And then also, if you're someone who's experiencing stress incontinence, specifically with like running, jumping, those types of activities, you want to make sure that you're getting an internal exam not only laying down, but standing. So you're actually gonna do internal exam like squatting and standing and doing functional positions, because those are the things that you need to see how you're doing. And if you're only ever doing it laying down, it doesn't really transfer into real life, right? So that's all I got for you guys. Do you guys have any questions? I know it's a lot of info. Like I said, I don't want to keep y'all here late, and I'm going to send this to you so you can look over it more. But anything that I didn't cover that you have a question on?
Well, I have a question. So, like I said, my baby's 11 months. And I mean, with exercising, it's high intensity stuff. But like on those days, like I was always very gentle with myself. Like I would do the weight training and everything, but I wasn't going to like start running and jumping all willy-nilly, considering,
Yeah.
But now, like, I feel almost 100%, but then the other day I was like jump roping and doing jumping jacks. I'm like, what the heck? Anytime I do a jumping jack, specifically jumping jacks, I'm like, okay, well, there it goes. I just beat myself. Like, I'm like, what the heck? It's such a like simple thing. Like I'll do diamond hill jumps, I'll do squat jumps, I'll do all the jumps, but a jumping jack specifically got me. And then we were doing jump rope and that got me too. And my question is, do you, how do I say this? Not like push through it or like go through it, or like are you supposed to still a year postpartum be gentle with yourself in that way and do modifications? Does that make sense?
Yeah. I mean, I think it's gonna be individual.
Mm-hmm.
But I think that a year is, I think a year is pretty far out enough to start doing the things you need to do, but it's always gonna be helpful if you can find where your threshold is. So like if you're finding like with jumping jacks, or is it like the first jumping jack, or is it after doing it for a while, like after a couple of jumping jacks? Is it like legs out position, legs in position? Is it both? So I would say finding, it might be easier because it's more of a specific, well, not very specific, but I mean, you certainly can gradually expose, but what I would do with whether it's leaking while you're jumping or if you have back pain when you're deadlifting, either way, I'm gonna say, okay, where are you not having back pain? So is it when you're picking up a barbell, or is it not until you're picking up 90 pounds? And you're like, well, no, I can do everything until I hit 90 pounds. And we're like, okay, so 90 is your threshold, your ceiling. We need to train below threshold and find ways to figure out below threshold what that looks like for you, what that looks like for a jumping jack. Is it a leg out? Is it instead of 2? You know, is it, you know, so basically going below threshold, training there, and seeing if you can get stronger in that position, and then pushing it from there.
And then the other question I have is like, most women who've had kids are just like, oh yeah, that you're just gonna pee yourself a little bit all the time for the rest of your life. Is that something that I should just accept, or are there things you can do?
No, there are things you can do, and unfortunately, you know, the whole thing is like, so if you had to put a percentage on like the stuff that I just went over, like 0% to 100 to, I've heard of every single thing, and I've had this conversation before. Would you say, like, what would you say percentage-wise of all the stuff that I talked about?
Wait, what do you
Like prior to coming today,
Yeah.
what information did you know, like from a doctor, from a professional, like percentage-wise, this information?
mean? Like,
50%? Okay, so to me, considering, I mean, 50% isn't terrible, but it's also kind of unacceptable.
yeah.
So I feel like for the people that say that that's normal, it's because it's so, this is just not communicated enough, and it's underserved, understood. I mean, it's like from medical community, especially if you're someone who's active, right?
Yeah.
So you might have heard of pelvic floor therapy before, and you might go to someone, but do they understand that you want to run, jump, lift, and do these things, right?
I want to feel 100%
Right.
again, you know, because the way that I performed before I had a baby, and now, I mean, it's similar, but like, you know, hip stuff is still a little funky, back stuff can still be a little funky. The peeing is new, you know. I had an episiotomy as well, so that's something that still gives me some discomfort. But I just like, I'm like, okay, well, you know, because they tell you as a woman, like, girl, that's just all hard work. And I'm
Yeah.
like, is it though? Like, I feel like I have a hard time accepting that.
Right,
So.
and I think that you shouldn't accept
Mhm.
that. So to answer your question, like, I think that there is, doing nothing is an option, but also doing something is an option. And so if you've done nothing, if you've done something for an extended period of time and you've decided that there's nothing we can do, it's a different story. But from my understanding, I think a lot of those people just haven't done anything and they've just accepted it, so.
They're just like peeing themselves.
I agree. I hate when
Yeah.
people say,
I
oh,
hate
it's just
that.
normal.
Yeah.
Right.
You're supposed to be like, okay,
Wow,
I just
like-
live this way forever.
No.
Right.
No.
We can do a jumping jack. What the hell? Like, you
Yeah.
know, I'll do diving heel jumps, but I can do a jumping jack. Like, that's ridiculous.
Yeah.
And you know, I figured like, I don't know, okay, well, it'll just take time, but then, you know, is time actually going to heal it, or like, you know, is there something else that I can
something,
do to expedite the process? Because
Yeah, and I think
Yeah.
part of it is like understanding that you are more than likely healed at this point if you're a year out, right? There's
Yeah.
nothing that necessarily needs to be healed anymore, but you probably just need more specific strengthening. Yeah.
yeah.
Just out of curiosity, what would you say, like, percentage-wise that you heard of this stuff? I'm gonna ask all of
Me?
you. Yeah. Like, of everything that you heard, like 0% to 100%, what would you say, like, of all the things that I went over?
Like 70%.
You don't know?
Oh,
what's
mine's way lower. I feel like I haven't heard of anything.
Really?
I'm like 20-30%
Okay.
maybe.
Okay.
Only because Adam introduced all of this before
But
I
you're like
left, so.
around physical therapy all the time. Like,
Yeah.
like I said,
Right.
like hospital stuff is foreign to me. So
Right.
if my doctor's not like, this is what you need to know, then I don't know it.
But it was
Because
only
I'm
a
not
year
like one to
ago.
sit at home on Google and, you know, WebMD my symptoms. I just
No.
don't do that.
Right.
Mm.
Which is good.
Because it's
No,
good.
there was
Right.
a pelvic floor specialist until, I mean, I was probably pregnant and starting to do all the searching and stuff. I don't remember which Facebook group, but they were all talking about the whole prolapse thing, and I'm like,
What?
Right. You would think that your OB would
I heard about the
like
app thing.
introduce
It's the
that
same.
Yeah.
when you're
She was,
pregnant.
like had 3 kids, and then she was telling me on her third, like she had that like mesh thing that I asked about in her surgery, and she's talking about how like your abs split to the side and then to come back to it, and I'm just like, okay, well I hope my abs come back together. Like, I've done it twice
For
before,
sure.
and I don't know, am I gonna get lucky a third time?
Roll up the dice. Yeah, that's the thing. It's like all these things are things I feel like we should be informed about.
Right.
It's like, it's something that everyone has a risk of when you're pregnant, and you should at the very least be told about it from your doctor or from your
Right.
OB or from someone. So I think that all kind of, the reason why I asked about the percentages is like, that all kind of brings us back to why people think it's normal, because it's so untalked about and so undereducated on.
Yeah.
So, you know,
I don't even think, if I had high blood pressure, so after I gave birth, I had to go back a week after. Had I not had my high blood pressure, I wouldn't have gone back until my 6-month checkup. So I'd be almost healed probably by then, right? Or like, so it blows my mind. You go so often, and then after you have your
You're
baby,
like-
you're
And they don't say anything.
You go, yeah, what is
Right.
it, like a
Even
few
though
weeks
you go
after,
so
I'm like,
often,
okay,
you know,
you're
they
good.
don't-
Right,
no,
bye.
I get so frustrated every appointment. I'm like, why did I just drive across town in traffic
Yes.
to be
Right.
here for you to go, oh, everything's perfect, see ya.
Right.
Like,
Yeah.
See you next week.
I didn't have like the blood pressure issues, but literally all they care about checking is like, they weigh you, they take your blood pressure, they ask you if you like
Feeling.
feel okay, and then they send you out the door, and like that is it.
Yeah.
You're just a number.
Right.
No one cares.
and then
Yeah.
in your 6-week checkup, or whenever your next checkup was, did you get an internal exam, or was it just like a verbal?
After the baby?
She
No, I didn't
did
get-
check me a bit. I don't know if it was because of the episiotomy or what, but I do remember a check because in general, I've always had a really hard time. That's when you were talking about like the internal. I'm like, oh god, no, never. But I know that it's, it would be great because that, scar tissue. I'm like, all right, like I know that. I don't know. It just. I don't know. She checked that anyway.
Yeah.
She's like, it looks all good. You can have sex. You want birth control. Like, what? I'm like, what? Is you kidding me?
Yeah,
Out of
let's do
bed. Off of me. Plus breastfeeding too. I'm
Right.
still breastfeeding, so it's like, yeah, I don't know, when you're talking about like the estrogen levels and like that, I'm like, oh yeah, it kind of makes sense.
Well, the
you know?
breastfeeding thing is like a whole other muscle group.
Yeah.
Like
Yeah.
we do therapy just for mom's nursing.
Oh
because
my
it's like
God.
you're literally walking
Right.
around hunched
Right.
over,
My wrist.
carrying this
Right.
human for like months.
Breastfeeding. It's
is-
crazy.
When you did the first workshop at 643, I was like on FaceTime with my
Yeah.
husband.
Oh yeah, I
Because I
remember.
was like, my wrist, it hurts. And it's only gotten, it'll get like a little bit better, but now it's like worse. And it's from breastfeeding, from
Yeah.
this. I looked it
Yeah.
up, it's called mommy wrist.
Wow.
Yes.
Mel
It's
has
from
like, she might have
this.
surgery on her wrist.
Because, well, she had two.
Isn't that crazy?
Yeah.
So-
So,
Oh, gosh.
tendinitis or
Wow.
de Quervain veins is really
It's just like
common.
nursing those muscles, man.
It's the
Yeah.
holding and then
Right.
also the lifting, like
Nursing is no
lifting.
joke, man.
It's no joke.
It's
Yeah,
no
so
joke.
I'll have to definitely look into that. So,
Well, we got
like
checked
upper back
because
muscle, it's almost
right.
like you have to retrain your shoulders to
Yeah.
like pull back
So
or something
right.
because you're just always like
punched.
like feeding this little person and you're just like sucking away.
Well, I had a C-section, so they checked me, but they checked my
yeah, I was
There's scar.
right, and there was like a stitch was sticking out of because they did like the dissolve ones on the inside, and then one of them was like poking out, so she had to like cut it.
Oh, fun.
I know. I was like, "Is that normal?" She's like, "No." So she cut it and like pulled it out. But that's the only time I was checked.
C-sections, a lot of people get like I forgot what it's called, but like the scar tissue that's really thick, the bump.
Oh
Yeah.
I don't.
Like a
keloid,
keloid,
yeah.
I don't have it. I just my belly
I've
is
heard a
just
lot of people with
awkward.
like the keloid thing.
Do you just have one?
Just her, yeah.
Yeah.
Yeah. And I still get sensitive down there. I don't know if it's just my brain, but
Yeah.
I feel like it's still like there's nights where it's like really tender.
Well, any part of your body that like that you have a scar that's been cut, like those
Right.
nerves around that cut are
Are
going
always
to be
gonna
like
be-
Yeah.
totally
Yeah.
connected.
Yeah.
So yeah.
But again, is that something that is normal? Or
Yeah,
is it
exactly.
normal? You know what I mean?
That's my thing. It's like,
Yeah.
okay, so do I just
A
have
lot
to
of that is like
look at-
desensitization training, which is just like actually touching, moving it,
Yeah.
like massaging
I
it.
hated it. Right.
And
I
that's
can't-
fine.
I could not do
I
it
don't
after.
like mine.
I feel like you need to
I'm
massage it,
going down there.
and I'm like, oh
Yeah.
I don't want to go down there at all.
terrible.
That's something that a partner can do, or a therapist can do, or you know.
Yeah.
You do that
all
here?
the stuff we're talking
Yeah,
about,
you do
you
that
do here, like
Mhm.
the stuff we talked about
Yep.
tonight, and like
Yeah.
the muscle training and all the things.
Yeah.
I pee myself the most at the gym.
Yeah.
Jump rope,
Yeah.
jump knee tucks.
Ooh, well, yeah.
Those are the two things that I pee myself. And when I laugh really hard at something.
Yeah.
Three
So
things
I will
that
send you
make
guys
me pee.
the PowerPoint. I'll email it to you guys. And if you guys are interested in obviously linking up, let me know. For the workshop, I'm gonna do 50% off an eval. So
Oh,
it's
nice.
so
That's nice.
if you guys are interested in working together, let me know. And I appreciate you guys coming and letting me
Appreciate
about
you.
this.
Yeah, thank you so
Appreciate
much.
you.
I'm like,
guys
alright,
are-
I'm just gonna ask her,
Sounds
cause
like
like,
we all
this is, I'm not gonna be shy, like.
We're all just
yeah,
being
no,
ourselves.
yeah, I'm just being myself, scar down there, I got
Your
know
wrists,
what to do.